Welcome you all. My name is Dr. PJ and Madam Rafi. Today we are going to discuss about hematopoietic growth factors. So first of all, hematopoietic growth factors is also known as cytokine growth factors. These growth factors are responsible for maintaining a balance between proliferation and differentiation of various cell types in the bone marrow. What are those cells? Erythrocytes, platelets, monocytes, neutrophils, eosinophils, basophils, B cells and T lymphocytes. Okay. So these cells proliferation and differentiation will be dependent on these growth factors. What are those growth factors? Erythropoietin and colony stimulating factors. In colony stimulation factors, CSF factors will have granulocyte CSF factors, granulocyte macrophage CSF factors and interleukin 11. So we will see each one in detail. First of all, erythropoietin. Erythropoietin is produced from juxtatubular cells in kidney and macrophage. This is an MCQ. Erythropoietin is produced from which area? Juxtatubular cells of kidney. These are natural producing. Okay, that's why in anemia patients will use some extra, that means synthetic forms. In this synthetic form, examples will be epoietin and darbepoietin. So what are those? Why this injection will be useful in which condition? We'll see in following slides. So what are the therapeutic uses? Therapeutic uses of this erythropoietin will be anemia of chronic renal failure, anemia resulting due to cancer and chemotherapy, anemia due to antiretroviral therapy, anemia in premature infants, to enhance autologous blood transfusion. Also, we use these drugs. So what are the adverse effects of these drugs? Will be flu-like symptoms, mild hypertension will be there due to overproduced production of blood cells, blood viscosity will be increased, hematocrit increases, leads to thrombosis. Okay. Next group will be granulocyte colony stimulating factors. These stimulate proliferation and differentiation of neutrophil progenitor cells and activate phagocytic activity of mature neutrophils. So, these main therapeutic uses will be autologous hematopoietic stem cell transplantation. How these will be helpful in this stem cell transplantation? Because they mobilize hematopoietic stem cells and increase their concentration in the peripheral blood. Thereby, will collect those stem cells and useful in autologous hematopoietic stem cell transplantation. Their examples will be filgrastim, pegfilgrastim. Okay, these are MCQs. Examples of GCSF, or they can ask autologous hematopoietic stem cell transplantation. Which drugs are preferred? Filgrastim, pegfilgrastim. Okay. Next is granulocyte macrophage colony stimulating factors. These stimulate development of many progenitor cells. So examples of this one is sargramostim, molgramostim, regramostim. Okay. So in these two classifications, GCSF is more important compared to GMCSF. Okay. So next GMCSF therapeutic uses will be reduce severity and duration of neutropenia during chemotherapy. That's why we will use. Next is stimulate and release of progenitor stem cells in peripheral bloods. Next is prevent persistent neutropenia in advanced HIV patients. Next, treatment of congenital neutropenia. In all those conditions, we will use the GMCSF drugs. Next important in the cytokine growth will be megakaryocyte growth factors. Okay. They will ask question. This is an IMCQ. That is megakaryocyte growth factor will be which cytokine? Interleukin 11. This cytokine is produced by fibroblast and bone marrow stromal cells. Analogs of interleukin 11 is oprelvekin. Okay, this is also MCQ. So this interleukin 11, they can ask which cytokine will be helpful in bone marrow synthesis. They will ask IL1, IL2, IL11, IL4 like that. IL11, analog of IL11 is oprelvekin. Examples, these are therapeutic use of this thing. This will enhance megakaryocyte, right? So obviously we will use in thrombocytopenia and idiopathic thrombocytopenia purpura. Okay, that's all. Thank you.